Okay, so that's a virus that you can get. It can be sexually transmitted. It also can go from mother to child. And it's a virus that affects the immune system of your body. So it actually goes into your T cells and it replicates in your T cells. T cells are part of your, originally from your thymus, and they help fight any kind of infection that you have. If you're HIV infected for a while without medication, you will end up getting more HIV cells and less cells in your immune system that can fight the HIV. And so what AIDS is a condition when your immune system has gotten depleted to a certain point. There's opportunistic infections that can happen, things that are around that you and I could fight off, that someone with a really depleted immune system can fight off. And those are called, those define an AIDS condition. Not from a mosquito,
Okay.
not from sharing a towel, not from drinking from the same glass, not from sharing a fork or some food. It's very specifically passed. It can be passed mother to child. It can be passed in birth. It can be passed through needles, and it can be passed sexually. You can never get rid of it once you've had it. When I first started working in HIV, there was just one medicine, but now there's about 30 different medicines that you can take. And you have to take a combination of meds in order to suppress the virus. It copies itself billions of times every day. It just makes a lot of copies, and sometimes it makes mistakes. So it takes 3 different medicines that work on the replication cycle from 3 different places to stop the virus. And you never can get rid of all of it in your body. So successful treatment is considered an undetectable viral load. You still have virus in your body. It's just less than 50 milligrams per ml. The numbers have gone up in a kind of scary fashion in the last, I'd say, 5 years, with kids, I would say 13 to 24, in that range. But if you looked at my population of clients, I think that most people that I have signed up as clients are like 35 to 45, in that range.
We have a prevention staff here and in Hilo, and what we do is we go into the schools and we do HIV 101. We work in domestic violence shelters, different court-ordered programs for youth, and we teach HIV 101, safer sex practices. We do outreach in the community. We go out to bars and different environments and do pass out safe sex kits, things like that. And then we have what's called Prevention for Positives inside this organization, and that's just helping people who are already positive make healthier choices and use safer sex practices to prevent the spread of the virus.
There's not a law that criminalizes HIV in this state. There are in other states laws that say that if you had sex, if you're HIV positive and you had sex with somebody else, you can be charged for whether you tell or whether you don't tell. You can still be charged for negligent homicide, I think. Although don't quote me on that, it might be a different charge, for having sex with another person.